Now, in normal diastolic function, typically we would see a lateral E prime that's greater than the septal or medial E prime. And there's a reason for this. So in the normal heart, the septal wall is slightly more restricted than the lateral wall. The lateral wall is able to move more freely. And so because of that, there's more motion, there's higher velocities with that tissue Doppler in the normal heart. With restrictive cardiomyopathy, the muscle of the heart just doesn't move as much because it's restricted. So when the myocardium becomes restrictive, there's impaired relaxation, and then the septal and medial E prime velocity is decreased overall, as well as the lateral. However, when we look at constrictive physiology and constrictive diastology, when there's constrictive pericarditis, the lateral E prime becomes reduced. And the reason for that is that there's tethering of the lateral wall because the pericardium is fibrotic, it is scarred, it is sometimes fused together. And so because of this, it restricts the motion on the lateral wall. And it doesn't shorten and twist the way that it normally would in normal function. And so the septal, the medial wall, or annulus at that point, when we're looking on tissue Doppler, overcompensates. And we call this mitral annulus reversus because the septal E prime velocity becomes significantly higher than it would in a normal diastolic function. And it's also significantly higher than the lateral wall. So again, when we review this together, we can see that the overall movement of the annulus is very different between the different physiologies. And so when we have that normal heart, we've got nice motion of that septal, but definitely increased in the lateral. However, with restrictive, just overall, it doesn't move quite so much. And with constrictive, that septal E prime velocity is going to significantly increase as it overcompensates for the lack of motion in that lateral wall. And so that results in tissue Doppler that looks a little bit something like this. You can see in the normal, your E prime velocity is a decent size. In restrictive, it's reduced significantly. In constrictive, it is significantly increased. Again, the diastolic hemodynamics take place